We are back. Welcome back to our next Tuesday topic. Today we're going to talk about nerve entrapments, peripheral nerve entrapments. So stuff like carpal tunnel, tingling in the fingers, tingling down the legs, sciatica, stuff like that. So being chiropractors and knowing McKenzie, which we've talked about before, the McKenzie method, we're going to rule out the spine. We're going to move your neck a bunch, move your back a bunch, make sure some of those symptoms down in the periphery, down your arms, down your legs, make sure those aren't actually coming from your spine, referrals, stuff like that. Once that's ruled out, then we go to nerve entrapment. So carpal tunnel is probably the most common example, but basically what that means is that our median nerve coming down here is trapped at the wrist, trapped at the carpal tunnel. Then we have symptoms in our hand. So we can do some things to assess this. We can tension the nerves, so put these nerves under tension and kind of differentiate, move something else and see if that affects the symptoms, because we're only moving the nervous system here. We're only kind of bringing those nerves back and forth. We can see if that truly is a nerve problem, or maybe it's something else. Maybe it's unrelated, musculoskeletal. So we can use neurodynamics basically and use the nervous system to our advantage to rule in or rule out if that is the pain provoking system basically. If that is, then we go 100% treating that area, treating the nervous system. We can do some flosses, moving the nerves back and forth and actually kind of gliding them, getting them unstuck basically from being snagged in muscles, in fascia and other tissues. We can take the nerves and kind of get them moving better, help with symptoms. Plenty of different things we can do, but basically that's one of our caps that we wear here in the office to see, okay, maybe it is a nerve issue. Now we go full on treatment on that. Sciatica is another great example. Sometimes it can be true sciatica. Sometimes it can be pinched in some muscles. It can be tight. It can be snagged. We can have some tension, inflammation, stuff like that. Or sometimes, as being chiropractors, it's coming from the spine. So that's one of the many caps we can put on to differentiate pain down the legs, pain down the arms, and some of those more nervous system symptoms. So hopefully you learned a thing or two. Thanks for watching, guys. We'll catch you next week.